Welcome to this week's deep dive. For anyone who's intimately familiar with that sudden, searing pain in your toe, or maybe the crushing frustration of a gout flare-up, well, you know just how challenging this condition can be. We understand the physical toll, definitely, but today we're also acknowledging the emotional and social weight of gout. The missed moments, limited mobility, sometimes that feeling that your life is shrinking around you. And we've all heard the advice about dietary restrictions for gout, right? Sometimes it can feel like your diet just has to be bland, boring, and frankly, utterly unexciting. But what if we told you that one surprising, vibrant, and yes, delicious fruit might hold some incredibly powerful insights into managing this condition, maybe even enhancing existing treatments? Today, we're embarking on a deep dive into cherries, really getting to the bottom of their effectiveness, their safety profile, and perhaps most importantly why, despite some really compelling information and widespread patient use, they might not be as widely discussed as you'd expect in conventional medical circles. Our mission today is to bring valuable, actionable insights directly to you, whether you're a gout sufferer yourself, maybe a caregiver searching for relief for someone, or perhaps you're just curious about this fascinating intersection of natural health and modern medicine. Get ready to uncover some intriguing facts that could genuinely change your perspective on gout management. So before we jump into our star fruit, let's just take a moment to acknowledge the real-world impact of gout. For the millions affected globally, it's so much more than just a fleeting discomfort, isn't it?
Oh, absolutely. It's a condition that can severely limit mobility, disrupt daily life, and truly cause intense, recurring suffering.
Yeah, we've heard countless stories, haven't we? People missing work, having to skip cherished family events, or simply being unable to enjoy their hobbies because of sudden crippling gout flare-up. It takes a huge toll.
That's a crucial observation. Gout flares, often characterized by those sudden severe attacks of pain, swelling, redness, and intense tenderness in the joints, most notoriously the big toe, but it can affect knees, ankles, wrists, too. They can be incredibly disruptive. Imagine waking up one morning and just the slightest touch on your big toe, maybe even the soft weight of a bedsheet, sends agonizing pain shooting through your foot.
Oof.
Yeah, it's a pain that can be so intense, people often describe it like walking on broken glass. And this isn't just about physical pain, it leads to significant mobility issues. Simple tasks like walking across a room, standing for any length of time, or even just getting dressed become immense challenges. This directly impacts one's ability to work, to participate in social activities, exercise, generally enjoy a fulfilling quality of life. And for caregivers, understanding this daily struggle and exploring all possible avenues for relief is just paramount. They often bear the brunt of seeing a loved one in such acute distress, feeling helpless, and constantly searching for ways to ease their suffering. It really is a shared journey, seeking comfort and finding solutions that work.
And when we talk about diet and gout, like I said, the immediate thought for many is restriction bland foods, avoiding all the things you love, feeling like your culinary world is shrinking. It's just another burden added to an already difficult condition. But our exploration today might suggest that the path to relief isn't about deprivation at all, but maybe.
Hmm.
Maybe it's about addition. We're talking about a common, vibrant fruit that could be a game changer, and it's certainly far from bland. In fact, it's quite the opposite. A burst of flavor and potentially a surprising source of relief. That's a profound picture of the daily reality for millions struggling with gout. And it brings us to a fascinating, almost counterintuitive next point. Our deep dive into the market numbers reveals something truly eye-opening. Almost like a hidden vote where patients are putting their money and maybe their trust in a very surprising place. It's kind of a David versus Goliath scenario playing out in the healthcare market, and the scale of it is just astonishing.
It really is. What's truly fascinating here is the sheer economic scale. The global cherry market reached a staggering $62.5 billion in 2023.
62.5 billion.
Billion, yes, with projections to hit an incredible $95 billion by 2030. Now, if we connect this to the bigger picture, the entire global gout therapeutics market that includes all pharmaceutical treatments designed specifically to manage gout, all the pills, injections, new drugs, it stands at a much smaller $2.8 billion.
Okay, wait, so 62.5 billion for cherries versus 2.8 billion for all gout drugs.
Exactly. This indicates a monumental 22.1 ratio. The cherry market absolutely dwarfs the pharmaceutical gout treatment market.
Wow.
Think about that for a moment. The global economic activity around cherries is more than 20 times larger than the entire pharmaceutical industry focused on gout. This isn't just a slight difference, it's a monumental disparity. It immediately raises questions about what patients are choosing and, well, why.
That's a staggering disparity.
Fine.
But is it possible that people are just buying cherries because they like them? They're a delicious fruit. How confident can we be that this market size truly reflects a patient-driven health decision specifically for gout management?
That's a critical question and a fair one, and it gets even more telling when you look at specific segments of the market. It's not just the whole fruit market. Even processed cherry products show this dominance, and often they are specifically marketed towards health benefits.
Okay.
Precisely. Take the cherry concentrate market alone. That single segment of the larger cherry industry is valued at $4.32 billion.
4.3 billion just for concentrate.
Just for concentrate, yeah. And it's projected to grow at a healthy 4.5% annually. Now, to put that into perspective, this single segment of the cherry industry is larger than the entire market for allopurinol.
Allopurinol being one of the main gout drugs.
One of the most widely prescribed gout medications globally, yes. That market is valued at only $1.5 billion.
So the concentrate market is almost 3 times bigger than the market for a leading gout drug.
That's right. A concentrated form of this natural fruit is, by itself, generating significantly more revenue than a leading pharmaceutical drug for the same condition. So it really raises that important question. What do these numbers, where patients appear to be consistently voting with their wallets and choosing a natural option, suggest about the landscape of gout management? It seems to indicate a profound underlying preference, maybe a trust in natural solutions, perhaps driven by real-world experiences that aren't always captured in, say, mainstream medical discussions.
Feels like a quiet but pretty powerful statement from patients themselves.
I think so, yes.
Okay, the sheer scale of the cherry market certainly suggests a widespread belief in their benefits. But is this just anecdotal, maybe wishful thinking? Let's turn now to the cold, hard data. This is where the story of cherries and gout gets really compelling, isn't it? What does the science actually say about their impact on gout beyond just market value?
Yeah, this is where it gets really interesting because the research presents a very compelling picture. A landmark investigation, specifically a Boston University study, tracked 633 gout patients for an entire year.
633. That's a decent number.
It is. It provided some truly compelling insights into the power of cherries. Now, just to add a bit of technical balance for our listeners who follow this closely, this was a large-scale observational cohort study, meaning researchers followed this significant group of gout patients over a year, collecting data on their cherry consumption and gout attacks in their real-world environment. Now, while this type of study can't definitively prove cause and effect like, say, a randomized controlled trial does,
Right.
it provides incredibly robust real-world evidence and identifies strong associations, especially with such a large sample size and that year-long duration.
Okay, so what did they find?
The findings revealed that cherry consumption alone was associated with a remarkable 35% reduction in gout attacks.
35%, just from eating cherries.
Just from eating cherries. That's quite remarkable for a natural food, a simple fruit, to have such a significant, measurable impact on a condition known for its debilitating and recurring flares. It suggests that merely incorporating cherries into your diet can provide a substantial protective effect against these painful episodes. That offers a tangible sense of relief to sufferers.
A 35% reduction from a simple fruit sounds incredibly promising, especially for someone dealing with chronic pain and frequent flare-ups. But, for many, conventional treatment is already part of their daily routine. What about when cherries are combined with pharmaceutical treatment? Does it interfere? Or maybe does it enhance the effect of existing medications?
That's a crucial question, I think, for patients already on prescribed drugs who are looking for every possible bit of relief.
And this is where the results become even more significant and, frankly, quite exciting.
Is it?
It really points towards a potential both-and approach, not an either-or.
Okay.
The study showed that when patients combined cherries with the pharmaceutical drug allopurinol, their risk of gout attacks plummeted by an impressive 75%. Whoa, 75%?
75. Now, compare that to the use of pharmaceutical drugs alone in the study that achieved a 53% reduction.
So 53% with the drug alone, but 75% when you add cherries. That's a huge jump.
It's a profound difference. Think about it. A 75% reduction means many patients could experience, 4 times fewer gout attacks compared to just using allopurinol alone.
That's life-changing.
It really is. This isn't just about feeling a bit better. It's about potentially regaining control of your life from these unpredictable flares. And, To understand this synergy a bit, remember that allopurinol works by inhibiting an enzyme called xanthine oxidase. That enzyme is central to the body's production of uric acid, the culprit behind gout.
Right.
Cherries, particularly tart cherries, are rich in anthocyanins. These are powerful antioxidants and anti-inflammatory compounds. Now, while they don't replace allopurinol, research suggests these cherry compounds might contribute in other ways.
How so?
Well, they might help by reducing the inflammation that actually drives the gout attacks, maybe supporting kidney function and uric acid excretion, or even potentially having a mild inhibitory effect on xanthine oxidase themselves.
So kind of tackling the problem from multiple angles.
Exactly. You're potentially hitting the problem from multiple angles simultaneously. And this powerful synergy, this amplification, could mean potentially reducing your allopurinol dosage, obviously under medical supervision,
Of course.
thereby minimizing the risk of those severe side effects we'll talk about, while still achieving superior symptom control and a significantly improved quality of life. That's the real power here.
That's a truly powerful synergistic effect. This idea of a both-and approach, it really does challenge the conventional wisdom, doesn't it? Which often seems to present patients with an either choice, pharmaceuticals, or natural remedies. What are the broader implications of this for patient care, maybe for shared decision-making with healthcare providers?
That appears to be the clear implication, yes. And it offers a pathway to potentially much better outcomes for patients. The lead researcher from that Boston University study, Dr. Yu-King Zhang, noted that even consuming just 10-12 cherries over a 2-day period provided significant protection.
Just 10 or 12. That's not very many.
No, it's not. It really highlights the potential of incorporating relatively small, manageable amounts of cherries into your diet to see a beneficial effect. This is an incredibly actionable tip for our listeners, something accessible, easy to try. It truly challenges that notion that effective solutions have to be complex or expensive or involve drastic, unpleasant lifestyle changes. For someone who's been suffering for years, the idea that a handful of cherries could make such a difference is truly empowering. It offers a renewed sense of hope, I think.
Absolutely. Okay, so beyond effectiveness, safety is just paramount, isn't it? For anyone managing a health condition, especially when you're talking about something you might take regularly, maybe even daily for a long time, we want to understand the long-term implications for our bodies. What do we know about the safety profiles here? Particularly when comparing cherries to common pharmaceutical treatments for gout. It feels like we might be talking about two entirely different categories of risk.
It's a critical question. How do the potential side effects and long-term risks of common gout medications stack up against, well, centuries of people just eating cherries? For instance, allopurinol, which we just discussed as a widely prescribed gout medication, carries a known risk of fatal hypersensitivity reactions. It's estimated at approximately 1 in 1,000 patients.
1 in 1,000. That sounds low, but fatal is fatal.
Exactly. And these aren't just minor rashes or mild discomforts. We're talking about severe life-threatening conditions like Stevens-Johnson syndrome and toxic epidermal
That
necrolysis.
sound awful. What are they?
They're extreme, widespread allergic reactions where the skin and mucous membranes literally blister and peel away from the body. It resembles severe burn.
Oh my goodness.
Yeah, it can lead to massive fluid loss, overwhelming infection, damage to internal organs. It often requires extensive stays in intensive care units and carries a significant risk of death. The possibility of such severe and, frankly, terrifying reactions is a constant, profound concern for both patients and their doctors. It's a very real prospect for a small but tragic number of people.
That's incredibly serious.
Yeah.
Just terrifying for anyone considering or taking the medication. Are there other examples of pharmaceutical safety concerns that highlight this stark contrast of potential risks?
Well, another notable case involves a drug called uric. Its generic name is febuxostat. It was reportedly rejected twice by the FDA due to cardiovascular risks.
Heart risks.
Yes, significant concerns for many patients, especially those with coexisting health conditions like heart disease. Despite these reported rejections, it was eventually approved in 2009. Over the years, uric generated significant revenue, reportedly $1.9 billion for its manufacturer, became a widely prescribed drug. However, it took until 2019, a full decade after its approval, for the FDA to reportedly add a boxed warning. That's the most serious type of warning.
10 years later.
10 years later, yes. A warning about an increased risk of death, specifically cardiovascular-related deaths. The drug was eventually discontinued in 2025. This timeline, A decade-long delay in issuing a boxed warning for a drug with known cardiovascular risks, it raises critical questions about the speed of regulatory responses to safety concerns, especially compared to other areas where swift action might be taken. It's certainly a point of profound concern for patient safety advocates.
It really speaks to a system that maybe sometimes moves very slowly on crucial patient well-being issues.
That's one interpretation,
Yeah.
yes.
And how does this, well, grim picture of pharmaceutical side effects compare to cherries? You mentioned they've been consumed safely for centuries. It truly feels like we're talking about two entirely different universes of risk here.
It really is a stark contrast. Cherries have been consumed safely for centuries across cultures worldwide,
Yeah.
in pies, juices, fresh, dried, all forms with absolutely no reported death attributed to their consumption.
None.
None documented. Think of the sheer volume of cherries eaten by billions of people over hundreds of years. No documented fatalities from eating them. The difference in safety profiles is just incredibly pronounced. And that's a critical consideration for gout sufferers and their caregivers who are seeking effective and, crucially, safe management strategies for the long term.
Yeah.
For someone looking for a sustainable solution they can rely on for years, the safety aspect of a natural food like cherries offers immense peace of mind compared to medications with such severe potential side effects.
Okay, so if cherries are so effective, according to that Boston study, and so remarkably safe, and the market for them is so astonishingly large, why aren't they more widely recommended? Or at least discussed more often in the mainstream medical conversation around gout? This seems like a real puzzle, especially for someone in pain who is desperately looking for every possible solution and maybe not finding this readily available information for their doctor. It really makes you wonder about how information flows or perhaps doesn't flow within the healthcare system.
This is where we delve into some of the, well, economic realities and the claims often made about information dissemination in the health industry. When you examine the cost differential between conventional pharmaceutical treatments and simply incorporating cherries, the picture becomes clearer and maybe somewhat stark. Annual gout treatment with pharmaceutical drugs can range significantly. We're talking from an average of maybe $3,985 up to as high as $25,778 per patient per year.
Wow, that's a huge range and a lot of money.
It is. This represents a substantial, consistent revenue stream for drug companies, totaling billions globally. The model is built on ongoing prescriptions and managed care.
Okay, and what about the cost of cherries? Which seems, as you said, almost negligible in comparison. How does that stack up?
Well, in comparison, a daily serving of cherry juice, or an equivalent amount of fresh or dried cherries, can cost less than $1 per day.
Less than $1 a day.
Often, yes, so under $365 per year.
Okay, so compare $365 a year to potentially $25,000 a year.
Exactly. This represents a staggering 70.1 cost difference. 70 to 1?
70 times cheaper.
Roughly, yes. And this 70 to 1 cost difference isn't just an economic footnote, it's a profound challenge to the traditional pharmaceutical business model. If a safe natural product can achieve comparable or even superior results at a tiny fraction of the cost, it directly impacts the multi-billion-dollar revenue streams of drug companies. This financial dynamic creates a powerful, let's say, disincentive for widely promoting such alternatives, regardless of their scientific backing. It forces us to ask, is information flow dictated primarily by profit potential or by patient benefit?
So the sheer affordability could be a significant factor in how information about natural alternatives is disseminated, or perhaps not disseminated. It's a challenging thought, especially when you consider the patient's urgent need for relief and maybe the slow pace of this kind of information reaching them.
That's certainly one perspective often put forward in discussions about this topic, yeah. The infrastructure of medical education, research funding, pharmaceutical marketing, it's heavily geared towards patented, profitable solutions. If patients could achieve comparable or superior results with cherries at a fraction of the cost, it could significantly impact the market for pharmaceutical gout drugs. This economic dynamic is sometimes cited as a potential reason why extensive information on natural alternatives, despite scientific backing, might not be as readily available or widely promoted within mainstream medical channels.
Are there specific instances that kind of highlight this challenge in information sharing, almost as if efforts were made to keep this information from the public?
There is a reported event that seems to illustrate this quite strongly. It occurred back on October 17th, 2005.
Okay, what happened?
On that day, regulatory bodies reportedly issued warning letters to 29 different cherry companies.
Warning letters. About what?
They were cautioned against sharing scientific studies about cherries' health benefits on their websites.
Wait, they were told not to share science.
That's the report. These companies weren't necessarily making outlandish, unsubstantiated claims. In many cases, they were simply linking to or referencing peer-reviewed scientific research about their products, like the kind of studies we've been discussing. Imagine you're a small cherry farm, maybe a family business, and you discover solid scientific research backing your product's potential health benefits. Naturally, you want to share that with your customers. But then, you reportedly get a stern letter from a government agency saying, essentially, stop talking out the science or you could face legal action.
Wow. That would have a chilling effect.
Exactly. That kind of action can have a significant chilling effect on producers of natural products who wish to inform the public about scientific findings related to their offerings. It signals a potential legal risk for merely communicating published research.
And how might this type of regulatory action, seemingly aimed at limiting public access to scientific findings, affect scientific research itself? It feels like it could create a kind of negative feedback loop that hinders progress.
It absolutely could. The reported scarcity of studies, particularly those robust enough for something called meta-analysis, is a key point that researchers sometimes note.
Meta-analysis, can you explain that quickly?
Sure. For our listeners, meta-analysis is considered the gold standard in scientific evidence. It's a powerful statistical technique where data from many different independent studies on the same topic are combined and analyzed together. This allows researchers to find a more precise and reliable overall effect than any single study could provide on its own. So when we talk about a lack of studies for meta-analysis, it means we're missing that kind of overwhelming combined evidence that truly establishes a scientific consensus.
Got it.
So while systematic reviews have confirmed cherry effectiveness in general, researchers have often expressed difficulty in conducting these comprehensive meta-analyses. Why? Because of a perceived lack of relevant studies that meet the really stringent criteria needed for that high-level data aggregation. Now, some argue that regulatory actions, like those reported in 2005 that sent a clear message to the industry, could have inadvertently reduced the funding or the incentive for further cherry research.
Makes sense if you can't talk about the results.
Right. If companies fear legal repercussions for merely discussing existing science, they are far less likely to invest significant money in new, extensive research. This creates a kind of catch-22.
How so?
Fewer studies get funded, so then critics can point to that lack of studies and say, see, there's not enough robust evidence for cherries, even when the studies we do have are really promising. It's a feedback loop that, intentionally or not, can effectively keep valuable information hidden in plain sight, ultimately affecting the general public's understanding and acceptance of cherry benefits.
Despite these challenges, though, and what seems like an uphill battle against established systems, it really does seem like patients themselves are exploring options beyond the conventional. There's almost a quiet revolution happening right now, isn't there? With individuals taking their health into their own hands, often driven by just a desperate need for relief.
Absolutely. The current medical system, despite having numerous pharmaceutical options available for gout, still sees many of the, 9.2 million Americans who suffer from gout struggling. They're dealing with poorly controlled symptoms and frequent, often debilitating flare-ups. Now, this isn't necessarily for lack of trying on the part of patients or even dedicated healthcare providers. It's more an indication that for many, the conventional approaches just aren't delivering the consistent relief they desperately need.
Yeah.
And this ongoing struggle has naturally led many patients to seek alternative approaches, often out of sheer necessity and a deep desire for better quality of life, for regaining control over their bodies. They're looking beyond the traditional prescriptions for solutions that actually work for them.
So what do the numbers say about this shift? Are patients genuinely moving away from traditional medications and towards natural remedies like cherries, or maybe at least incorporating them more?
The statistics are quite revealing, actually. They're pretty compelling, showcasing a significant patient-driven movement. A comprehensive survey revealed that a significant 42% of gout patients actively use cherry products to manage their condition.
42%, that's almost half.
Almost half, yes. Now, in stark contrast, only 33% consistently take their prescribed medications as directed.
Wait, so more people are using cherries than consistently taking their prescribed drugs?
According to that survey, yes. More gout sufferers are proactively using cherries than are consistently adhering to their conventional drug regimens. That speaks volumes about patient agency, maybe trust, maybe perceived effectiveness.
Definitely.
And what's even more telling, perhaps, is that 67% of patients, That's 2 out of every 3 believe cherry juice works just as well as expensive pharmaceutical drugs.
Two-thirds believe it works just as well.
Yes. This isn't a small fringe segment. This suggests a profound, patient-driven shift towards natural solutions, often explored and adopted outside of traditional medical advice or direct doctor recommendations. It truly represents a shift in patient behavior and belief, largely driven by real-world experiences.
It really sounds like patients are actively making choices based on their own experiences, their own bodies, and what they perceive as truly effective for them. Do we have any personal accounts that kind of illustrate this patient-driven shift? Real-world testimonials can often be much more powerful than just statistics, can't they?
Indeed, they can. One survey respondent shared a particularly insightful testimonial that really reflects this growing trend, and it's a sentiment echoed in many patient communities and online forums. This person said, "I have not had an attack of gout for at least 3 years. I put 15 Montmorency whole dried tart cherries on my cereal each morning. I'm not going to mess with success."
Simple as that. Not going to
Oh.
mess with success.
Exactly. This kind of testimonial is incredibly powerful because it reflects real-world success stories. It speaks directly to the experience of finding relief and sticking with what works, even if it wasn't the first thing prescribed by a doctor. And I've heard from countless individuals who maybe initially felt skeptical, but then, out of sheer desperation sometimes, gave cherries a try, often describing it as a last resort that actually became their first line of defense.
Wow.
These anecdotal accounts, often shared within patient communities, they provide invaluable peer support and validation. They reflect a growing trend of individuals taking a proactive role in managing their health, exploring options that bring them genuine relief and improved quality of life. So for our listeners, this really highlights that you are not alone in seeking practical, perhaps non-traditional solutions, and that many others have found remarkable success with approaches like incorporating cherries.
Okay, so wrapping this all together, what does all of this mean for you, the listener? Especially if you or perhaps someone you care for is struggling with gout right now. What are some key actionable tips we can take away from this deep dive? Things that can be immediately applied to daily life, maybe discussed with your healthcare provider.
Okay, first, the data strongly suggests that incorporating cherries into your diet could be a really valuable and effective addition to your overall gout management strategy. Whether it's fresh cherries when they're in season, or the readily available dried Montmorency tart cherries, or even a high-quality unsweetened cherry juice concentrated on. The study suggests that even relatively small amounts could offer significant protection against those awful gout attacks.
Right, like the 10-12 cherries mentioned earlier.
Exactly. The Boston University study indicated that consuming just 10-12 cherries over a 2-day period could provide meaningful relief. This is an easy, accessible, and frankly enjoyable way to potentially reduce the frequency and severity of your flares, and it definitely makes your diet less bland.
That's a huge bonus right there. And crucially, this doesn't necessarily mean abandoning existing treatments, does it? It's not about choosing one over the other, but perhaps find the best combination for you.
Exactly right. That's perhaps the most compelling finding, and maybe the most hopeful for many patients, the potential for synergistic benefits. Remember, the Boston University study indicated that combining cherries with allopurinol was significantly more effective. It led to that 75% reduction in gout attacks compared to allopurinol alone, which yielded a 53% reduction. This really points towards a future where natural and pharmaceutical approaches might work hand in hand to achieve better outcomes, potentially even reducing the need for higher drug dosages while significantly improving patient quality of life.
That's a powerful message for both patients and their doctors.
It really is, and it's important to remember, of course, to discuss any changes to your treatment plan with your doctor. But this research certainly provides a strong basis for that conversation, opening up possibilities for a more integrated, more holistic approach to managing gout.
This truly challenges that idea that gout management has to be bland or restrictive or purely pharmaceutical. It really does open up a world of possibilities for a more holistic and, like you said, potentially more delicious approach to managing this challenging condition. For so many people, the idea of a bland, restrictive diet is just another burden on top of the pain. But knowing that a delicious fruit could actually be part of the solution, that really transforms the perspective, doesn't it?
It absolutely does. It adds an element of pleasure back into managing the condition.
Well, that wraps up our deep dive into the fascinating world of cherries and gout. We really hope this conversation has given you some valuable insights, some actionable tips, and perhaps a renewed sense of hope in managing this condition. It's truly inspiring to see how a simple fruit can offer such profound potential benefits and maybe challenge some conventional thinking along the way. If you found this discussion helpful and maybe eye-opening, please remember to subscribe to Deep Dive so you don't miss our next exploration. We're committed to bringing you the most intriguing and practical information to help you navigate your health journey with knowledge and confidence. Join us again next week as we continue to explore surprising ways to empower yourself. Until then, remember, relief from gout may be closer and tastier than you think.